If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 10th season, and we are here to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. One, by calling the live phone line, and two, by visiting our website, netny.net/askthedoctor. Here you can submit questions and opinions via the forum. For this episode, I have Dr. Helen Kilkin-Sogoloff, pulmonary medicine attending at New York Methodist Hospital. Then next to her is Dr. Natan Haratz-Rubenstein, Director of Advanced Women's Imaging at New York Methodist Hospital. And then we have Dr. Alexander Shaknovich, Cardiology attending at New York Methodist Hospital. Welcome, everyone, and we have a great show planned for you tonight. You're going to be very excited to have these guests. Two are returning guests, and Dr. Haratz making his first appearance, I'm sure not his last appearance. We're very excited about that. And I don't want to take a lot of time up, but we do have some in the news to discuss. So first in the news, new hope for multiple sclerosis now. Let me just show you something that I brought in here. I brought in an MRI of a patient with multiple sclerosis to try and help you to understand what happens in the disease. And it's an autoimmune disease. We've talked about autoimmune diseases in the past when we've talked about arthritis. And in arthritis, the body interprets the joints as enemies and sends out these killer cells to try and destroy them. Well, in multiple sclerosis, it's also an autoimmune disease, and the body sends out, again, these killer T cells to destroy parts of the brain, the spinal cord, and the nerves of the eye. And you can see on this MRI, the white spots are abnormal. This is actually scar tissue where the T cells have gone in and killed that part of the brain and left this residual area of dead brains, dead nerves. And what happens is, depending upon the nerve that's been affected, you have different symptoms. You may have double vision. You may have trouble walking. You may have trouble swallowing. You may have trouble breathing, depending upon what stage and how it's been. And unfortunately, it strikes people in the prime of life, 20 to 40 years old. In the past, these people had to take injections of medications that would try and stop these killer T cells from working. And the injections could be very painful and could interfere with normal lifestyle. And we had a major advance about a week ago now. 2 pills were developed that people could take orally. They don't have to give themselves injections. And these pills worked to kill these killer T cells so that they would not attack the brain. Now, it's good, but there was a problem. It kills the T cells that normally help the immune system. So these people now were getting cancers and they were getting infections, not at a very high rate, but at a higher rate than normal, than would be expected, maybe 5 to 10%. So now we're in the beginning stages, and these pills may be approved actually by the end of next year and change the way people with multiple sclerosis live, improve their lifestyle. But the hope is that we'll be able to find pills that we could control a little bit better and just kill the T cells that are heading to the brain, to the spines, and so on. So it's a major advance. It's something that's good news. And the good thing about multiple sclerosis is actually that most patients live relatively normal lives. There are unfortunately some that are more severe, some cases that are more severe than others that have a relentless course. And it's something that the patient and doctor will have to decide. Should they take the new medications? Is it worth the risk? But I thought it was something interesting, and I wrote more about it in the tablet, so you can read about that on Sunday. I have Dr. Shaknovich here from Cardiology, who will be talking about this, but the American Heart Association actually published 7 ways to live longer. And they make a lot of sense. I don't think it's any earth-shattering thing. Get active, eat better, lose weight, stop smoking, control cholesterol, manage blood pressure, reduce blood sugar. Now, that's all you say, well, this makes sense. Turned out that up to 50% of adults didn't really have a feel for what was a normal blood pressure or even what their blood pressure was. So it seems very simple, but if people could do simple things, we may be able to cut down on deaths from these diseases. the American Heart Association has a quiz, and if you go to our forum, you can link onto that quiz and answer questions about yourself. They ask what your blood pressure, cholesterol, and so on, and it gives you a number, how healthy you are, how likely you are to have a long life. And this will be good, I think, because it can help encourage people to do simple things. I know that Dr. Shagnovich always talks about doing the simple things, you know, not necessarily the fancy things, take a walk, things like that. So I hope you will go on this website. And finally, there was a kind of an interesting story about fat, and we all think fat is bad, but it turns out that not all fat is created equal. Just as not all cholesterol is equal, there's good and bad cholesterol, there's good and bad fat. And it turns out, to the pleasure of most of the men, that the fat that goes around the hips and the derriere, we should say, is actually a healthier fat. It actually helps to sop up some of these harmful free fatty acids and other chemicals that might cause inflammation. And it's interesting because when they took mice that had this characteristic fat around the hips, and they took a transplant of the fat from the hips and put it into other mice's stomach, the mouse started to lose weight and started to be healthier. You know, I don't know if we're going to be transplanting this yet. Now, we have our quiz. I know you're out there waiting to get this quiz, the coveted plaque. This is the quiz for today. What English word keeps the same pronunciation when you take 4 of its letters away, 4 of its 5 letters away? So what English word keeps the same pronunciation when you take 4 of its 5 letters away? This is Dr. Linda Lapatosa, our quizmaster, worked hard to get this, and I hope that you're going to have a good winner there. So let us do this. Let's take a short break, and when we come back, we're going to go right to our busy phones. I see they're already flashing. Our phone number is 718-499-6101, where you can talk about lung disease, women's health, and cardiology. Again, the number is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are lung disease, women's health, and cardiology. The number to call is 718-499-6101. The phones are busy now, but keep calling because they open up as the people get on. I want to say Monsignor Bennett has not missed the show. Hi, Monsignor. How are you doing? Monsignor's moved out to Kings Plaza area. You like it out there? It's good to see you, Monsignor. 10 years he hasn't missed the show. And let's talk to our guest now, Dr. Sokolov. It's great to have you. When was the last time you were here?
It was the pre-flu season. Now we're post-flu season.
Oh, now we missed it. Yeah.
Yes, we missed it.
What kind of season did we have, by the way? What would you say?
Recovery season, I would call it.
Yeah.
Now we're seeing all kind of pleuritis and coughs and fluid in the lungs, so we're recovering from flus.
Did you see though, I mean, we were all nervous that we're going to get this overflowing flu and the swine flu.
I think this year we were very lucky. We didn't really see that many complications as we were anticipating since last spring.
Yeah, I think we lucked out because
very fortunate.
Yeah.
Very fortunate.
So where did you go? You were on vacation recently?
Yes.
Where were you going?
Well, actually, I was in Caribbean islands.
Any flu there or no flu?
No.
No.
a lot of happy memories.
That's
so
nice.
Yes.
That's nice. And I know you have two children.
2 children, yes.
They're out there watching, maybe.
Hopefully, hello, if you're watching.
If you're not watching, we're gonna, punish them afterwards. But anyway, thanks so much for coming. We're going to talk about lung. I know a lot of asthma questions and bronchitis, lung disease, emphysema. So thank you so much for coming. And Dr. Haratz, it's a pleasure to see you here. We wanted to get you on a long time. And first tell us, where did you grow up?
In Venezuela.
Wow. What was it like? Now we kind of get the feeling Venezuela is kind of a tough place, except for that Citgo guy that's always looking so happy. Yeah. What is it like?
It was a great place to grow up in, and medical school was great. It was free.
Wow.
And I loved it. But I just came here for training and decided to stay. It's a beautiful, beautiful, beautiful country.
What's the thing you like most about this? Something that was so different from growing up that you just said, I love this about the United States.
Order. order, organization, systems.
Fairness. Yeah, it's great to see. And just so people should know a little bit about what you do, and I'm always amazed at it, Dr. Arad's, in addition to taking care of women for gynecology problems, obstetrical problems, runs an amazing place where actually you can take sonograms of the little babies. You know, we often forget the baby's a living thing, and he shows the legs, the arms, the eyes, and can actually sometimes save a baby's life in the mother's uterus by identifying a problem that can be fixed, right?
Right.
So I know a lot of women out there are going to have questions for you, and thanks for the great work you're doing for coming here. Thank you. Dr. Shaknovich, who's many times now, you've been back several times.
This is my third or fourth, actually. I've enjoyed them.
And we always love your, I tell you, I was saying, I don't want to put the pressure on you for philosophical discussion tonight, but I always like the way you put things into perspective. And
Thank you.
you know, I always like the way you talk about a middle-aged guy who develops blood pressure, who's feeling bad, and you have a way of making him feel better.
Well, what I tell my patients is that it's the relationship, the partnership that we create that is the object of what we do. I tell my patients that the difference between a good doctor and a bad doctor is that a good doctor has fewer bad patients. So I tell them that my role is to help them enter into a complex sphere of healthcare and integrate it in their personal lives.
That's great, because you really help ease people into different stages, right? Because you can't avoid, you know, if you fight it, it doesn't make sense. There is a natural order of getting older.
Well, I think, again, it's long overdue that we present healthcare as a normal part of adult journey, as it were, rather than a misfortune.
But thank you. Looking forward to all the cardiology questions, women's health questions, and lung disease. So let's see who's going to be the first caller of the day. Hello? By not answering, I'm guessing this is going to be
Hi,
Maddie.
Dr. Gardner.
Yeah, hi. Is this Maddie?
Yeah.
Hi, Maddie. Happy birthday.
Thank you, Dr. Gardner.
Maddie last week was how old?
89.
89 years old. And Gus from Avenue J. Flores sent over the flowers 2 days late, but it was all right, Maddie?
That's okay. Better late than ever.
Yeah, Maddie didn't know what they were for. She said, "What are these flowers for?" So Maddie, can we help you with anything tonight? I know you're feeling.
My fingers are numb and cold. What is that? Poor circulation?
Yeah, well, Dr. Shaknovich.
Very, very unlikely to be a serious circulatory problem. Anything is possible, but typically it's related to the way your body handles blood flow to your skin. If your toes are discolored or cold, that, especially if there's a history of smoking or diabetes, in fact may be a clue to an important circulatory problem.
Maddie, how are your toes?
I'm not cold. My fingers are cold.
That's good. So Dr. Shaknovich says not something we're going to have to worry about.
Certainly.
Okay.
We're going to have you around for many more seasons.
Okay.
Okay, Maddie?
All right.
Thanks a lot.
Thank you.
Be well. Let's go to Grace now. Hi, Grace. Grace?
Yes, it's Grace. I called last week about my orthopedic problem.
Yes, how are you doing?
Yeah. Well, I didn't go. I didn't go to the doctor. I was supposed to go to my orthopedic surgeon, but I have another problem. I have a thyroid problem for about 8-9 years. It got straightened out with levothyroxine.
Okay.
Taking it every other day, not every day. It didn't agree with me every day. Just every other day seemed to make my thyroid go down to 2.3 or 3.4.
Okay.
And I was doing good, but then I got in my eye. I got a. Tony, what do you call that? A glaucoma attack. It jumped to 50 in my eye.
Okay, wait. So we got a bunch of things going on here. Are you Are you able to get out and walk around?
Not that much, no.
Do you live in Brighton Beach?
No, I live in East Flatbush.
East Flatbush. Okay.
Yeah. Now, what I want to ask is, I took a blood test. See, I had 5 laser surgeries in my eye, and both eyes to make holes from laser. So this way, I had it done in one day. I had 4 operations, laser in one sitting. So it came down to 16. Now I'm taking drops for that, but
Grace. So let me just, because I know because so many people waiting.
Yeah, but
so Grace
I want to know if that could, if anxiety could cause my level to go higher, because my thyroid now is 11.4. I never had that.
Okay, so Grace, First of all, anxiety cannot cause those numbers to increase in your eye to that level. No, that's the problem with the disease, glaucoma, which you're treating.
No, I'm saying the level of the thyroid from the nervousness of having my eyes operated.
Right. So now let's talk about thyroid disease.
Yeah.
Dr. Sokoloff, thyroid disease, how old are you, Grace?
75.
75. What kinds of symptoms would people have? How would they know they have thyroid disease?
Well, certainly glaucoma and thyroid disease under these circumstances are not related. And usually with the thyroid disease, and especially in women, the thyroid gland becomes a little bit sluggish. So you should definitely watch your blood pressure, and you have to check your thyroid blood work regularly just to make sure that you're taking enough medication. But you should not worry, your vision and glaucoma is not connected to the thyroid disease at all.
I got to go to a younger age group with thyroid disease. Can thyroid disease in younger women prevent them from normal pregnancies and so on?
Yeah, actually, one of the things that you would want to check when you're evaluating somebody for infertility is thyroid levels, because TSH, which is a thyroid stimulating hormone, can have an effect on the so-called brain ovarian connection.
Grace, hang on. We're going to get back to you because I want to get through.
He says now I have to take a thyroid every day, and he's going to check that to see if it comes down.
Yeah. So, Dr. Steiner, with thyroid disease and heart, how would somebody know from a heart standpoint?
Certainly a very important connection. It sounds like your thyroid is hyperactive, and it sounds like you're taking medication to lower the output of the thyroid hormone. And it's critically important that you get your thyroid levels down, because hyperactive thyroid gland can cause anxiety, can cause palpitations. But I think what you're also telling us is that there are lots and lots of simultaneous medical issues that you're grappling with, and this is where you need a bit of help. You need someone who can help coordinate your managing all the problems that unfortunately we have to face as we get older.
Grace, I want you to call us back next week. I hope that is part of the question, and we're going to get back to you next week. So thanks, Grace. Let's go now to Larry. Is this Larry from Rockland County?
Yes, Dr. Garner. How are you?
One of our most loyal listeners. You watch on the computer?
Well, yes, I watch on the computer because I can't get that channel.
You got to call up your cable company and complain about this.
Yeah.
We actually have people now in Phoenix who listen, watch on the computer.
Well, that's great. That's wonderful.
But what can we do for you tonight?
I wanted to speak to the cardiologist, Dr. Shaknovich.
Thank you.
He's right here.
My question is, when I exercise on my treadmill and I've eaten, this is after I've eaten, I feel pressure that radiates into my right underneath the sternum, and there's a feeling of fullness. However, when I do it on an empty stomach, or if I've had a light meal, I don't have that problem. And since since I've had heart surgery, I'm always concerned about strange kinds of feelings, and I was wondering if the doctor had any comments about that.
Certainly, I would encourage you not to exercise on a full stomach. This is not good for you in terms of the potential challenges that your circulatory system may have to face, but also our gastrointestinal system is not necessarily designed to be exposed to high levels of physical stress, and if you regurgitate any of the meal that you may have ingested, that may cause symptoms that may be very hard for you to distinguish from symptoms of coronary artery disease. So one, I would not exercise on a full stomach. Two, I would see a cardiologist and have a supervised exercise test during which they can monitor your cardiogram, blood pressure, and rhythm, and perhaps do additional tests to help you understand whether or not the operation that you had continues to give you...
functioning.
I remember from previous shows, didn't you have diabetes? You have diabetes?
Yes. I'm a diabetic.
How many years ago did you have your surgery?
In 06. At the beginning of 06.
Okay, so again, and you've been followed carefully, I assume?
Oh, yes, I see my cardiologist every 6 months, but I've just become a little more aware of this issue because I'm trying to exercise on a daily basis, and I do it at random times.
Well, I think it's very good that you are trying to exercise regularly, but I think it would be prudent for you to alert your cardiologist that you may have developed new symptoms, and, and there are relatively straightforward and reliable ways available to you and him to address any potential causes. And Dr. Garner was reminding us that diabetes can interfere with transport of food from your stomach, and of course that can also contribute to your symptoms.
That could be a problem.
So
like
please get that checked out.
Gastroparesis, is that what you were just mentioning?
Right, it's unlikely that's what you have, but there may be multiple reasons why you're not feeling well, and I certainly would encourage you not to exercise on a full stomach until it gets sorted out.
Would you call us back next week and let us know?
Yes, but I also wanted to tell you that I happened to be doing a puzzle the other day, and I can answer your...
Well, if you can answer this question, you're going to make a lot of people unhappy who are out there. But no, you have an opportunity to get this plaque. So I hear the drum roll. I thought that was my stomach gurgling. But
okay.
Can we hear that drum roll one more time?
The answer is yes. I hear it.
You hear it? Okay.
The answer is Q.
Q is the right answer. I can't believe. Do we have the pandemonium sound effect? No, we don't have that one.
Okay.
But anyway, no, there's tremendous excitement in the studio. I don't know if you could see Dr. Shagnovich's face. I haven't seen him this excited since he's caught an arrhythmia once. But thank you so much for this. Now you're going to get this handmade plaque out of Japan, which a lot of people like Eastern art. And it'll Linda Lapatosa will be making this out to you, and it should be on your way. We send it out freight, so what has that? 4 days, 4 or 5 days.
I thank you.
Can you hold on to the phone? Give him your number, and your name, and so on.
All right.
Okay, you're very excited.
Yes.
I can hear it. I hear it. Okay.
Whoopee.
Thank you for the call, and watch out for the heart. Don't get too excited. Okay.
Okay.
Thank you. We don't want to lose the call as it is. We have a hard time. Joel.
Oh, hi, Dr. Garner.
Joel,
how are you?
I thought you were going to be first. We haven't heard from you in the 10th season yet.
Well, I've been trying to figure out all the quiz questions. I spend most of my time doing that.
This is it's okay. We'll give you some therapy, and that can go away. But
okay.
What can we do for you tonight?
I have a question for Dr. Herat.
Oh, great.
So my sister, she's pregnant. She had a regular ultrasound, and she's wondering about this 3D ultrasound. Should she get it? Is it safe?
Well, 3D ultrasound is great because it allows you to see a lot of the surface anatomy of the fetus and also a lot of the internal organs. However, if she has no issues and the pregnancy is going fine and the baby looks normal, it's really unnecessary. So that's where you go into this quote-unquote recreational use of ultrasound. And although there's no real negative effect that has been demonstrated in diagnostic ultrasound at the power levels that we use, you really don't want to expose the mother and the baby to unnecessary sound. So if there is no issues with the pregnancy, it just becomes recreational and it's unnecessary, really.
So
okay, thanks, Dr. Herat.
So Joel.
Yeah.
This is an issue because I know a lot of people like to get a picture of the baby.
Yeah.
And what do you tell? Do you tell your patients it's okay? Or?
Well, if you are at a medical facility that's accredited by the American Institute of Ultrasound and Medicine, and you're doing a scan already, and you are looking at all the different parts that you're supposed to look at, and you want to get a quick 3D view of the face, I don't see any harm in that. As far as you just do it, it takes a couple of seconds, and you're there already in an accredited facility.
But like Tom Cruise coming at me.
Well, that's a whole different show. But if you are just going to go to like a mall to get a picture of the baby, I think that's certainly unnecessary, could be dangerous. You don't know if that person is trained or accredited. So I don't see any harm in doing it if you're in a medical facility that's accredited with personnel that's trained, and you are there to look at the baby anyway. To turn on the 3D, it's literally just a couple of seconds, and I don't see any harm in that. But to just do it for that purpose, it's at this point unnecessary. Unless there is an anatomy problem, you have spina bifida, or you have a tumor, or you have a cleft lip and palate that you want to evaluate even further, then it's fully indicated.
Joel, yeah. Hope that helps you.
Okay, thanks a lot. I'll let her know.
Call back soon.
Okay, bye.
Okay. We got a Jim now. Hi, Jim.
Hi, Dr. Garner.
Where are you calling us from?
Calling from Maspeth, Queens.
Oh, Maspeth. Yeah, we have a lot of loyal listeners out there. Never could
Yeah,
find...
we have a good restaurant on 61st Street, if you want to know.
Yeah, I was going to ask because we never could find too many good ones out there.
Three Sons. It's an Italian restaurant on 61st and Grand Avenue.
This is a nice one. I'm going to write that down. Three Sons.
Yeah, very nice.
Interesting. I ate an interesting one called Telly's Taverna in Astoria. Did you ever hear that?
No, I didn't.
I think I'm going to recommend this one because it's very simple. The fish is so fresh, you can't get fresher fish, and the price very reasonable. So I'm going to try the Three Sons. Maybe you'll try Telly's Taverna.
Okay, very good. Yeah,
what can we do for you?
Well, I had a question about coronary artery disease for the cardiologist.
Okay, Dr. Shaknovich is right here.
Doctor, how do you feel about the use of stents as a treatment?
Well, even if I'd asked for a better question, I don't think I would get it. I actually was involved in placement of the first coronary stent in New York State in '91. I've been using stents since they were in early clinical trials.
Are you doing a Doppler here? What is? I hear this noise. Is that? Okay, go on.
Stents are wonderful technology when used correctly, and that's true of so many things we use in medicine. Stents have revolutionized our approach to advanced blockages that we see in various body conduits, not just arteries, but also airways, urological conduits, any cylindrical conduit that we can reconstruct. Stents have been very, very helpful with. They've been used a little bit too much, I think, in the coronaries. Frequently, physicians get a little bit eager to fix blockages that can be safely treated with medications. So I typically tell patients that they need to have a reliable chain of advisors. You need to have a good internist who recommends a sound cardiologist, and if you have a chronic illness, you establish a long-term partnership with the cardiologist. Even if that cardiologist does not do procedures, it is his responsibility to recommend someone who then remains accountable to you, and the referring doctor does a diagnostic angiogram and then makes a decision based on what is in the patient's best long-term interest. So it's a long answer. Stents are wonderful technology. They continue to improve. They're more deliverable. They give us better long-term results. They all require that you take medications afterwards to keep them from developing blood clots on their surface. They require follow-up, and they certainly have to be integrated with all other things that patients need to do now to keep their arteries open.
Thank you.
Doctor, are you familiar with Dr. Sharma at Mount Sinai?
All too well.
Okay.
We'll leave it at that.
He does good work?
Whenever patients ask me whether a particular doctor is good, I ask them if they remember the name of the pilot on the airplane they flew last. Very few do.
Unless you got Sully. What's his name? Sully.
Right, and you remember him only after he landed you in East River. So again, look, doctors are important. Patients are more important. Relationships are more important than patients and doctors.
Jim, have a good night.
Thank you, Doctor.
Take care. Before we go to the break, I have to ask Dr. Sokoloff, what's the most difficult patient that you treat? What disease entity do you find the hardest?
Actually, it's a very easy answer because it's very difficult to treat the chronic obstructive pulmonary disease.
What does that mean? Because just so they know, COPD.
COPD.
What does it stand
there
for?
are a lot of diseases that go under this umbrella: asthma, bronchitis, bronchiectasis, emphysema, and it's very difficult because there are very few toys that we have in the pulmonary disposal. Cardiologists have a lot of toys. They have stents, they have multiple medications, there have been a lot of studies. In pulmonary medicine, there are a lot of advancements, but not enough to make a significant difference. That's why it's very important to have prevention, be that stop smoking, take antibiotics, make sure that you take the flu vaccine. So prevention is key, absolute key in this disease. Otherwise, you're in trouble, unfortunately.
So that's a word to the wise out there. Stop smoking, live right, and get in to see the doctor soon. And let's take a little break now, give a chance to pay some bills. We got the, it's not a low-budget show, even though the drum roll is a little weak. But our phone number is 718-499-6101. We're going to talk about lung disease, women's health, cardiology. So let's take a short break, do what you got to do, and we'll see you back soon. Thank you. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are lung disease, women's health, and cardiology. With me I have Dr. Helen Sogoloff, pulmonary medicine attending, Dr. Nathan Haratz, Director of Advanced Women's Imaging, and Dr. Alexander Shaknovich, cardiology attending, all at New York Methodist Hospital. Before we get to the phone, we do have the web, where people are writing questions to the web, and I thought we'd take a chance to, and answer 3 of them right now. So the first one is Mary. Mary says this, and I'll ask this to Dr. Shaknovich. I have been half-heartedly trying to lower my cholesterol, only to have it increase more and for the worse. The doctor gave me 3 months more before drug therapy, which I do not want to embark on. Could I have your opinion on just how bad my cholesterol is? And she gives numbers. Cholesterol total 244, HDL 48, bad cholesterol LDL 156, triglycerides 200. So could you give her a quick answer to that? How bad is she?
Again, I don't like to look at cholesterol that way. First, of course, it depends on other considerations. So it depends how old you are, depends on whether you have diabetes or not, depends whether you're pre or postmenopausal, depends on whether there are others in your family who may have developed premature heart disease, but it also depends on the way you approach your health. In general, I tell my patients that an elevated cholesterol is like dirty clothing. I mean, it's not a criminal offense, but most people tend to avoid wanting to be seen wearing dirty things. So, again, it's a discretionary decision at this point. It is illegal in this country to drive without a seatbelt. It's a choice we've made. We've decided that we will coerce each other to do a sensible thing and drive wearing a seatbelt. My contention is we should coerce each other and insist that we all have reasonable cholesterol levels.
Okay, Mary, I hope that helps. Now let's go to Molly's question. Molly's pregnant. She's very happy. 3 months pregnant for Dr. Haratz. She wants to know what's present at 3 months. If she were to look at the sonogram, what could she see?
Well, 3 months is about 12 weeks, so actually you can see a lot. You can see basically all of the main organs are there, and you would actually be able to recognize a human life. You would see, a baby moving around, and actually 12 weeks is an amazing time because with the resolution of ultrasound we have these days, we can see more and more, and we can do sort of what I like to call, and other people have called, a mini anatomical scan, where you can actually see and rule out a lot of the major problems. Of course, we're not going to see a tiny detail, but you can see fingers, you can see toes, you can see head, trunk movements. You actually can see a lot at 12 weeks.
So, Molly, can you tell if it's Mary or Mark?
You can, at 12 weeks, it'll be hard.
How about college tuition?
College tuition. Molly, best of luck. And actually, with our producer, Teresia, we followed her pregnancy on a month-by-month basis, showing how young, actually, that you see a little human being. It's amazing.
Yeah, 3 months, if I may say, it's crucial because we have so many diagnostic tools, so many screening tools that actually the best time is between 11 and 13 weeks. So if you can get to your doctor and get to your prenatal ultrasound at that time, you're really doing a favor to yourself.
And thank you, Molly, and once again, good luck with that. Call us back. Maybe we'll do a monthly thing with you. Call us back in 4 months, okay? And Salvatore worked at the World Trade Center cleanup, and he says that he never had lung problems. He's 47 years old, and now he's having trouble breathing. And he wants to know, is it related to working at the World Trade Center? Have you seen that?
Of course, the answer is yes, and he has to be evaluated very carefully by CAT scans and lung function test. just to establish whether or not he has
What should
serious
these
changes.
people get? Actually, said well, everyone should get a CAT scan that had this type of
Definitely should have a CAT scan because you need to see whether or not the person is developing fibrosis. It's a fancy word for scar developing tissue in the lung. And if indeed he does have it, he has to be treated as soon as possible because I don't know how old this gentleman is. 47. It's a very young man. So we usually have people live in this country till mid-80s, so it's
so it really bothers me when people try and say, oh, it's not related to you. You know, you see a lot of people getting sick, and maybe some take advantage, but I think the majority, you know, hardworking people that had this.
Because there is no direct correlation that was established in what happened during 9/11 and lung disease. We all assume, but once again, to say if there is a direct correlation, there were studies made. No, but you have to be evaluated.
Sad case.
Most definitely.
Very sad. We have Myra who's been waiting patiently. Hi, Myra.
Hi.
Hi, Myra. Where are you calling us from?
I'm calling from Brooklyn. I'm calling from Linden Boulevard.
Linden Boulevard. I was just there earlier tonight at Downstate.
Oh, were you?
Yeah. My daughter's doing a residency there. So.
Oh, okay. Congratulations to her.
Do you have any place to suggest her to eat near there?
No.
No. How come? We need something better there. There's a Dunkin' Donuts across the street, right? That's about it?
That's about it.
Yeah, that's well, maybe we'll go into business one day. Huh? What can we do for you?
Okay, I just came home from Beth Israel Hospital. This is the one in Brooklyn now on Kings Highway and New York Avenue. Last Sunday, I went into the hospital vomiting. I didn't have stomach pain, though, but I had vomiting. So they said it was my gallstones and my gallbladder, which I had removed last Wednesday, so tomorrow will be a week. But anyway, I came home Friday, and I still have a lot of mucus, and my breathing is a little funny, so I wanted to know, should I be concerned, or is that normal?
Right, so she had surgery, having trouble breathing. Dr. Sokolov's going to take that one.
Okay.
I think that it is not uncommon to have a lot of mucus production after this surgery because it takes a while for the gut to wake up, so to speak, and to start moving and get rid of all the leftover of the surgery. I would not be concerned unless you had serious lung problems before that or cardiac problems before that, which would be also a reason for shortness of breath. But it's not uncommon. I would not worry about this unless you start having fevers or unless you start having worsening shortness of breath, green mucus coming out of your lungs with cough, but not otherwise.
And the only other problem is with the mucus, I don't know how, people tell me how to bring it up. I don't know how to cough and bring it up. I had swallowed, I know it sounds nasty, but I had swallowed it. So I can't see what color it is.
I see. And you're saying the people ask you to bring it up to...
Yeah, someone asked me, how does it look? So I said, I don't know. I said, I swallow it. They said, you're not supposed to swallow it. You're supposed to bring it up. But I open my mouth and I try to, I just call it hard.
No, actually,
I
think it's
only...
only...
And it won't come.
No, actually, I think it's only natural for swallowing the mucus as opposed to spitting it out. Once again, it is not uncommon.
Okay.
Unless you have fevers, I would not be worried about what the color of the
There's one quick question. I have to ask this. People are obsessed with this color, and does it correlate that if you have green, it's not good, you're infected? If you have clear, do you find that works?
Absolutely, because green is pus. There's no other definition of it. There's no other description. But once again, if somebody has no problems with before that, unless you have a serious pulmonary problem, or unless you have, going back to fevers and constant cough, which might possibly indicate pneumonia after surgery, just having mucus, it's not,
Myra,
it's not uncommon.
Yes.
We're glad to hear you feeling better. There used to be a fertility. The more fertile you are, they used to say, the more likely you might have gallstones. Did you have a lot of children?
I don't have any.
Well, there goes that theory. So, okay. Anyway, thank you very much.
All right,
Take
then.
care. Bye. Okay, we now have Minnie. We've never had a Minnie before. Hi, Minnie.
Hi.
This is the first time we've had. I love that name.
Oh, thank you.
Is it a nickname or that's the full name?
No, that's my name.
Wow, it's beautiful.
Thank you.
Where are you calling us from?
Brooklyn, New York.
Which part?
Crown Heights.
Crown Heights. We get a lot of Crown Heights callers. Again, not many good restaurants we've heard about.
Yeah.
Do you have one in mind?
No, not really.
No, I don't understand. You know that. What would be a food that would be your favorite food if you had to cook a meal? What would it be?
Southern food.
You like Southern? The
Yeah.
fried chicken?
Yeah.
What do you think about that, Dr. Shaknovich?
Love it.
You love it? Okay. All right, the cardiologist says it's all right. So what can we do for you?
Okay. I suffer from a condition called lymphoderma. I don't know if I'm saying it correct.
Lymphedema?
Yes.
Okay.
Of the thighs. Okay, one is real big and one is just starting to grow because I had an accident years ago with my ankle. And the doctors at the hospital where I used to go that's closed down never informed me that I needed to wear some stockings when I had the accident. So they never told me about this condition until years later I found out I had to look on the computers to see what I had on my leg.
Okay, so let's talk about quickly what is lymphedema and what are some of the causes and treatments.
Again,
Okay.
fortunately, it's a relatively rare condition. I'm sorry if you happen to have it. Again, it's not anything cardiologists commonly see or deal with. Typically, it falls to our surgical colleagues normally or vascular specialists. It has to do with swelling that develops in tissues from which drainage of the lymph is obstructed, and that can be obstructed due to anatomical causes or due to chronic infection or due to previous surgical procedures that may have resulted in impaired drainage. The most common cause in this country is secondary to radical breast surgery in women who have axillary lymph nodes treated. And they have to be very careful with their arms that can be swollen. Certainly, there are malignancies that can cause lymphedema. In Africa, there are parasitic diseases that, of course, can cause severe and disabling lymphedema. I would very, very strongly recommend that you find someone who takes you under his or her care. It sounds like this.
I had one doctor, a vascular doctor.
Right.
And he's like, he don't even know what to do with it. He told me to take tests, and they put the machine on my leg to see if any of my arteries are blocked.
Right.
And that was it. And so he does nothing else. And
Right.
he just gave me some bandages.
Right.
And
it used to be the doctors, we become a little spoiled as doctors and as patients. Every time a patient and a doctor meets, there's an expectation that we will always be able to do something. Unfortunately, it's not the case. It used to be very rarely that doctors could do very, very much. So patients are very discouraged often when the doctor says, I'm sorry, but there isn't anything dramatic that I can do for you.
yeah, that's the way I am now.
That's not the reason to be facing this by yourself. I think it's all the more reason for you to find someone who would see you on a regular basis and help you deal with a variety of other downstream problems that may unfortunately arise with the passage of time. So
Minnie, we can help you find a doctor. Why don't you give us a call tomorrow, the number on the screen,
Okay.
and I'll get you somebody, okay?
Oh, thank you so much.
Okay, I hope you feel better.
Oh, thank you.
Take care. We now have a web question for Dr. Haratz, actually. Someone who went for a scan and has extra beats on the evaluation of the heart. How serious is that? How common is it in a five-month-old?
Actually, that's very common, and we see it all the time, and they're usually called premature atrial contractions. And certainly when you see that, it's very scary for the mother because you see this heart who's beating all over the place. And the right thing to do is to do a full-length evaluation of the heart. And that can be done by a pediatric cardiologist or an obstetrician with maternal fetal medicine training or cardiac fetal training. And if the heart is structurally normal, which is usually the case, then these are extra beats that are very common. They usually resolve within the length of the pregnancy, and they usually, if they don't resolve during the pregnancy, they resolve afterwards. And if the heart is, again, structurally normal, there's nothing to worry about. There is a faint association with heart block and lupus. So even though a premature atrial contraction is not necessarily a heart block, you want to check for lupus in the patient. But it's very common, it's usually benign, and it just needs to be evaluated by a fetal echocardiogram. And if those are all normal, then most likely the baby's going to be just fine.
Thanks a lot. Seemed like we didn't know a lot. Somehow we had these babies with no sonograms.
Right.
And now we know so much. Anyway, we're going to go to Giselle now. Giselle? Hi, Giselle.
Hi.
Where are you calling us from?
Queens, New York.
Oh,
Woodhaven.
Nesbeth?
Woodhaven.
Woodhaven, yeah. That's not far from London Lenny's, right?
Right.
They're having their big anniversary sale. You know, back same price, I think 40 years old.
Oh, okay. I didn't know that.
Yes, no, you call, you learn. So
yes.
what can we do for you?
Well, I suffer with sleep apnea, and I sleep with the CPAP machine.
Okay.
And lately I've noticed that my vulva I wake up with my vulva swollen.
Uvula.
Vulva, right?
Yeah, uvula.
Uvula.
That's the other, there's another.
Right. Swollen, and that's happened more than once. And last night I had such a restless sleep. Every hour or even less.
I'm going to get right, Jill. I get the picture. I just want to ask Dr. Sokolov, tell us about this, first of all, this horrible machine you got. How do they
it's
sleep
terrible.
with it?
I've been sleeping with it like 5 years.
Wow.
And, I just wanted to know, do I need another sleep study? Is there another treatment that I could possibly,
Unfortunately, the answer to the question is no, there is no other treatment. It is very uncomfortable, and I can certainly sympathize with that. There are recommendations usually for people with obstructive sleep apnea, which is losing weight. That is probably the only thing you can do outside of using the machine. I know it is not a comfortable treatment, but it is absolutely necessary. I don't know how old you are, but
I'm 44. And I have lost like 30-some pounds, but I did gain some back, so I guess that's affecting my sleeping?
Certainly. It certainly is affecting it, and the recommendation would be try to lose weight. Definitely use the machine. Why? Because if you do not, you're a very young woman, and in an older age, you will develop all kinds of cardiac problems which are associated with obstructive sleep apnea.
I have high blood pressure already.
Yeah, so, but unfortunately, whether or not to repeat the sleep test, I don't think so. I don't really think so, because I know though you gained some weight, there's probably no help in getting evaluated again.
Sorry we can't do more for you, but
oh, no, that's okay.
Feel better.
Okay, thank you.
Okay, take care. Hi, Georgia.
Yes, hello.
Hi, where are you calling us from?
From New York City.
Oh, Manhattan?
Yes.
Very nice. We like the Manhattan callers. Which neighborhood?
I'm on the Upper East Side.
Oh, very nice. We have a number of viewers actually from 83rd Street. Are you near there?
I'm on 71st.
Yeah, it seems like something in the air. I don't know. We had a lot of Ask the Doctor viewers on in 83rd. But, what can we do for you?
Well, I actually wanted to just share this information. I had just brought my mom home from the hospital. She was in for a week. She went to St. Francis on an emergency last week. And what I have been taking her to the doctor for the past year, and it all started with that she was complaining of shortness of breath. So then I took her to her regular doctor, and then he referred her to a cardiologist. He did the basic stuff that every cardiologist does, the stress tests and the Holter monitors and all that. And basically, everything came out fine. They saw some notes of an arrhythmia, but nothing major. And then when she ended up, they put her on a beta blocker. So she's been on this beta blocker for quite some time. And just last week, but she still had shortness of breath, and every time we kept going back to the cardiologist, she would still say, she doesn't feel good. Her chest, it's tight, and shortness of breath. And in any case, discovering now at St. Francis when she was went to the emergency room, and the whole week, I mean, this was a huge revelation. They did a special, I think the Dr. Sokolov will appreciate this, the pulmonary doctor. They found that she had asthma. And they did this special breathing test. It was very computer-generated, and these large tubes. And these beta blockers, this is what I found very interesting. The beta blocker was making her worse because it's a antagonist, to for asthma. So they took her off beta blockers, and now they have her on, asthma medication, and they have her on cardizem to keep her heart rate at a, at a level.
Yes.
So I'm just gonna move it ahead because I want to make sure we get the end. And you tell a good story, though. I enjoyed the way you built it up to the asthma part. But tell Dr. Sokolov, is this common to miss?
It is common, absolutely, because when people come and they're coming with shortness of breath, it's not necessarily cardiac. It can be cardiac, pulmonary, thyroid, low hemoglobin, deconditioning. So once you have one organ, so to speak, ruled out or included or excluded, you just have to look at everything else. You definitely have to look at the pulmonary component because it's not uncommon to be diagnosed with asthma in an older age. Certainly you have to look at the hemoglobin, once again thyroid, and if you do indeed have asthma, beta blockers are probably not the best treatment for...
But Dr. Shainovich, does that mean if you have asthma, you can't ever take, because beta blockers are sometimes indicated. What do you do?
Beta blockers are not absolutely contraindicated in asthma. If I have a patient who has concurrent reactive airway disease and coronary artery disease hypertension, I walk over to Dr. Sokolov and ask if she minds if the patient is on the beta blocker. We work in the same office. No, but in all seriousness, beta blockers often are necessary in patients with atrial arrhythmias or coronary artery disease, and they have to be used judiciously. And I certainly want to reiterate what Dr. Sokolov said. You consider one organ system. If it offers a satisfactory explanation, you initiate treatment. If the patient is better, you are more confident you're doing the right thing. If the patient is not better, you have to certainly consider other options, other explanations.
Thank you. I appreciate the call and hope that...
Can I add one thing?
Just quickly, yes?
Yeah, quickly is with the asthma as well, and if she were to take a certain albuterol, that also is contraindicated because then it raises the heart. So they gave her a different type of, an asthma. So I just find these details are just so crucial, and I wanted to share that with so if other people can benefit from it because she's feeling
great. And again,
terrific right now.
It shows you the need to get second opinions and third opinions sometimes, and you did.
Yes.
I'm glad you did that.
Yes,
Thanks a lot.
you.
Let's go now to Bob. Hi, Bob.
Hi, Dr. Garner.
Where are you calling us from?
Upper East Side, near Donahue's.
Oh, I like that. I love that place. Actually,
you know who it is.
yeah. He took me to Donahue's. It's a great place near Bloomingdale's, right?
I have a radiology and cardiology question mixed.
Okay.
If people have stents, I know that they have the pictures on the radiology screen. There's been a lot of discussion in the last week or two in the papers about CAT scans and things like that where there are different levels of radiation. Is there a possibility in the doing stent work or angioplasty, things like that, where there can be over-radiation?
Okay, well, I'm going to ask, actually, I'll take that one quickly, and then I'm going to go to Dr. Shagnovich.
Right.
You definitely can. Actually, in Cedars-Sinai Hospital in California, people got excessive radiation at supposedly a great hospital because they didn't check the dosages that people were receiving for a year and a half. So I stress that it's important to ask the technologist, what is the dose of radiation I got during that procedure? Because they add up, and 5 or more CAT scans begins to give you a risk. Now, getting the CAT scan for the right reason, though, is not a reason not to get it. That risk, the benefit far outweighs the risk. Dr. Shagnovich.
Certainly, it's a very good question. I am an angiographer, and X-ray exposure is something we always have to consider in making our recommendations for invasive procedures. Typically, these procedures are done on older patients, and typically in those patients, the indications far overwhelm the potential untoward consequences of radiation exposure. Procedures generally now don't take very long. The equipment is generally very good. So unless you are very young, it's typically not a consideration beyond making sure that whatever procedures you have are truly indicated.
Thanks, Bob. We've got to get together again soon, okay?
Okay.
Take care. And now we're going to Sandra.
Hi.
Hi, Sandra. Come quickly because we only have a little time.
I know. Okay. Well, this is the issue. During my menstruation, I get several symptoms, but one of them is something that is a little odd, and it's been occurring. It occurs like maybe once every 7 months. I get something underneath my arm that looks like a pimple, and it usually goes away about 3 or 4 days after when I'm completely finish with
I'm going to get
period.
Dr. Haratz to get in on this right away so we don't...
Yeah, does that happen just in one of your arms or both?
One, sometimes, yeah, usually just one.
And
sometimes it's both.
You feel like a little fullness there?
A little fullness?
Yeah, is that what it is?
A little fullness? What do you mean full?
Full, like you have a lump there.
No, not a lump.
It's just pain?
It feels like a pimple would, on your face when you're breaking out. You can touch it. It doesn't really do anything, but just stays there and goes away.
Well, it certainly could be, it depends on how it looks. Somebody would have to take a look at it, but it could be just a skin reaction related to the hormone changes of menstruation, or actually it could be an extra, I was asking if it was bilateral, it could be an extra breast, actually.
Yeah, Sandra, we got to run with that. It could be an extra breast, but what we got to... Yeah, but we got to run. No, it's a true story. It's not a joke. It's a possibility. So it's something you want to get either to your doctor, Dr. Haratz. You want to call us, we'll get you some help on that. Okay?
Thanks
a lot. And quickly to our final caller, Mr. Joe Stiles. Joe?
Speaking.
How are you doing?
Great.
One of the most productive people in New York, sits on several boards, Knight of the Holy Sepulchre, and just a perfect way to end this show. Joe, what do you have to say? Any words of wisdom?
Yeah, I have words of wisdom. What I have to say is that Dr. Garner, which I know him for a couple of years now, he makes a great image and role model leader on this program. He's a great morale builder, and it's a great thing in the medical field. In many years that I spent, almost 60 years in the medical field, I had a question about myself about the medicine I take for my heart and my pressure.
Joe, thank you so much. We got to move on. I hope you could hear that out there. It was a nice tribute, actually. I can't believe the time's flown by. That's it for this edition of Ask the Doctor. I'd like to thank Dr. Helen Sogoloff, Dr. Nathan Haratz, and Dr. Alexander Shaknovich for coming in. I want to say, by the way, that Dr. Shaknovich and Sogoloff work in a facility that's amazing, that I went there and used it myself. I've never seen a finer facility on Ocean Parkway, down the end of Ocean Parkway. Any problems there, I really suggest. And Dr. Haratz's facility is amazing, too. Has probably the largest experience in dealing. So if you're pregnant and you want to take a look at the baby and so on, make sure it's well, definitely get in to see him. So we hope we're able to help you. And it's always good to remember to be proactive about your health. Speak to your doctors. Speak about your concerns. Go for second opinions like our Upper East Side friend, or third opinions. In the meantime, continue to watch the net and visit our website at netny.net/askthedoctor. Here you can check out past quizzes, submit your thoughts on the forum, or just watch past episodes. I want to thank you for all your calls tonight. And I'll see you again next week. So goodbye, stay healthy, and I'll see you in the tablet.